Hey guys, it's Emmanuel here, and I'm here to talk to you about how to prepare for your nursing interview at university. There's many factors that you need to look at. Now, I'm going to give you tips on what you should do and how you can prepare on the day to day before the big days come, really. Now, a lot of people, I've looked at a lot of videos, and a lot of them explain the numeracy test, literacy test, which is perfectly fine, which isn't essential. There are other factors, however, that may help you get into university if you don't do as well at those two topics. So I'll give you an example. So basically, if you're the type of person who's very shy and very timid, you're gonna have to work on that. You're gonna have to find a way to be more outspoken and just be a bit more approachable if you're not. Now, that's one of the things that we're looking at is, are you approachable, are you talkative? Because soon as you enter that room, they're going to be analyzing the assessors, the lecturers. They're all going to be watching your body language, how you've presented yourself, and if you're talking to people while they're preparing the test papers or what have you. So it's important to communicate, introduce yourself. You don't have to be loud and outspoken about it. They will see you talking to them. So that's my first tip. Talk to your peers, talk to people around you, because these may be the people you may be studying with when you get in. Now, my second tip is um, obviously the numeracy and literacy. Prepare, prepare, prepare. Just revise the next day. It's very simple. Just work on the things that you're not so good at and just practice on it. I wouldn't stay up until midnight practicing and grinding out a 3 hour revision session, because your brain is a muscle, and if you overwork it, it will relapse and get very tired and may not function as it should. So I would say do a few quizzes here and there, take a few breaks, do a few more quizzes, get a good night rest, and prepare. Some universities, they are calculated and non-calculated based, so you may have an advantage. If you're the sort of person who's good with a calculator and knows the formulas, you'll be perfectly fine. However, if you're not, then I would suggest that you prepare. But the universities will tell you whether or not it's non-calculated or calculated based anyway. Now, with the English, I would say just make sure that your wording's correct. Make sure if you struggle with spelling, just make sure you just do a few quizzes on spelling. Your paragraphs, make sure you section everything off accordingly, and you should be fine. They ask you, some of the questions that they asked me at some of the universities were, I'll give you an example. How does devices divide people? So the like your mobile phone, how does that? How is social networking, for example, dividing people? You can talk about that on a personal level because you may be experiencing it, because we are in 2017 now. I mean, we are likely to be going through that divisive phase now. But yeah, again, sometimes it may not be relevant to, nursing, which is quite peculiar to me. I don't understand why it wouldn't be, but it isn't. It's just how some universities work. Now, I remember speaking to a lot of people about the grades when they apply for a UCAS. They look on some of the universities and they see, oh, you've got to have 30 distinctions in order to register, in order to be unless in order to even be sort of accepted or even looked at. I can tell you this now, they do say that because as a university they will set the bar very high, but doesn't mean you don't stand a chance. And I can give you an example of that because I got 27 distinctions, right, on my adult nursing diploma. And I said to them, I called them and I said, is it worth me applying, because I've got 27 and you want 30? Am I still going to be able to even apply? And they said to me very vaguely, we'll look into it. I still applied anyway. So, and then when I went there, I was very humble about myself. I was just very keen to listen, and I even spoke on my own views on nursing and why I want to be a nurse, because they will challenge you on that and just stand your ground, not aggressively, but stand your ground. And after it was all said and done, I ended up getting an invite anyway, saying that you've been accepted and we want you to study at our university. So never be sort of never procrastinate whether or not you should choose a particular university based on your grades. Some of them may just look at the character and your ability and who you are and think, you know what, maybe they just need to brush up on certain areas, but overall I think they'll be a good student as well. So don't be discouraged. I think you should definitely still go for the university you want. Um, that's one of my main tips as well. Just be yourself. Don't don't try and be someone you're not. Don't try and come across that you know everything, because no one likes people like those. I would say as well, when you get the group interview, it's so important that you do as much talking as you do listening. So if you do a lot of talking, be aware of how much you're talking, because there's other people that need to get their point across on a particular topic. Try and spread it across the board. Try and engage. Try and challenge people to their opinion on what they think of something. Just try and be involved, but not too involved to the point where you're trying to be dominant over the conversation, because no one likes someone like that. They will feel as if you're trying to outshine everyone, and it's not about that, because in nursing, it is a teamwork based job. So I would say try and be a balance, try and find a balance. Now, the final part is the one-to-one interview, which a lot of people get caught up in because they feel, because it's so relaxed, because it's so informal, they feel as if they can mirror match that. I can tell you now, do not mirror match it. It is a strategy. It is very strategic for them to do that, because they want to see who you really are. So I would say be a bit of both. Be a bit formal, be a bit informal as well. Show that you have a laugh. Show that you are a human being still. If you go out clubbing every night, there's nothing wrong with saying, yeah, I'd like to go do a bit of clubbing here and there, but as long as you can't bring it back and say, but once I start my nursing career, and call it that, because it is, once I start my nursing career, I know for a fact that's not going to be the case anymore. It's about prioritizing. You're showing a balance. You're showing you're humorous and you're fun, but at the same time, you're showing you're disciplined. So be very strategic. I mean, in a nutshell, I mean, I'm only giving you this advice because I applied for 5 unis and I got interviewed for every single one, and I know what they're looking for. So I would say some of them don't mind how you do on the test. Some of them care more about your personality and who you are. Some of them care solely on the tests, numeracy and literacy, and they do consider other aspects about who you are as well. So, I mean, it's all about choosing the right one and seeing how you do. But anyway, guys, I hope this has helped. I'm going to start doing a lot of blogs now, or vlogs anyway. But I'm going to be doing it, try and do it on a weekly basis, because I'm starting my nursing course in February, and February the 20th. So if you do need any hints and tips on what to expect, please let me know. Definitely subscribe and let me know if I can help you with anything else. I'm going to help you do drug calculations, the bursary changes. We're going to talk about so many different things. Just let me know what it is you'd like to know, and definitely like and subscribe, and yeah, we'll just take it from there and see what happens in the next 3 years. But yeah, thanks guys, it's Manuel White speaking, and peace.